Hello, Kent County EMS providers. My name is Kyle Smith. I'm a paramedic as well as an education specialist for Kent County EMS, and today I wanted to talk to you about the Leave Behind Narcan program. In an effort to combat the opioid crisis and introduce harm reduction into EMS, Kent County Emergency Medical Services is introducing the Narcan Leave Behind program for all ALS transporting agencies within Kent County. This program will allow you, as EMS providers, to leave behind a kit containing Narcan and other valuable resources for patients who have suffered an opioid-related overdose or who have identified as having a substance use disorder. Why is a program like this needed in Kent County? Well, in 2024 alone, there were documented 784 Narcan administrations between EMS and fire. These numbers do not include administrations from police officers who do carry Narcan or administrations from community members. As EMS providers, we encounter these patients at some of the most vulnerable moments in their lives. And we also have a unique opportunity to not only provide immediate medical care for these patients, but also provide the tools and resources for them and their families to help prevent any future tragedies. Let's talk a little bit about what's actually included inside the Narcan kits. They're going to come packaged just like any other medication that you would receive from the pharmacy. They have a sticker on the back that gives who it's packaged by as well as an expiration date of the Narcan. Inside the kit, you'll get one box of Narcan that comes with 2 separate doses of intranasal Narcan. You'll get a quick start administration guide for patient reference. And you'll also get a QR code that will direct the user to a website hosted by Kent County EMS that has tons of Kent County specific resources for patients with substance use disorder. If you need to restock or resupply a Leave Behind Narcan kit, you can find them in the EMS rooms of the emergency departments within Kent County. I want to go over some questions or concerns that you may have when you leave behind one of these Narcan kits. Will I increase the potential for further drug use if I leave one of these kits behind with a patient or a family member? If a patient possesses illicit substances for recreational use, it is very likely that they are going to be consumed despite having access to Narcan or not. By leaving these kits behind, we give access to these patients to possibly reverse an opioid-related death. Another question you may have as an EMS provider is, what happens if I leave behind this medication and it's used improperly or causes harm to a patient? In Michigan, there is legislation that prohibits legal repercussions for EMS providers who administer or leave behind Narcan. This is true even if the administration of Narcan does result in harm to the individual, as long as the administration was given with good faith intent. So what is expected of you as an EMS provider from the MCA when you leave behind one of these Narcan kits? I don't want to give out another mnemonic, as we know EMS is already full of them, but I just want you to follow a simple 3-step process. We're going to identify, supply, and document. We're going to identify if the patient has an existing substance use disorder or has recently gone through an opioid-related overdose. We're going to then supply them with a Narcan kit, and then we're going to document in our PCR that we have left behind one of these Narcan kits and provided any education that the patient may have required. These kits should be documented as a treatment or a procedure, but may differ based on the software that your agency uses for PCR documentation. If you need further assistance on how to document leaving behind a Narcan kit, please reach out to your supervisor or field training officer. If you'd like any further information or training regarding the Leave Behind Narcan program, I will put a link below in the description that will link you to a 1-hour MyTrain program through the state of Michigan. And if you need any further information or just have any questions regarding this program, please do not hesitate to reach out to me personally. I will put my information in the description as well. I know you're busy out there serving our communities, and I wanted to keep this short and sweet, so thank you for taking the time to watch this presentation, and have a good day.